Okay, there we go.
We are live in Memorex.
It's such a pleasure. This is Sascha Jovanovic here as the official host.
Ed McLaren
And
here.
I have Dr. Ed McLaren here in front of me on the screen. And first of all, we're in, of course, two different locations. And secondly, as you can see, we're very isolated and separated from anybody. I'm always like, looking at that video, which is literally like, less than 12 months old. And if you think, Ed, like, I was just like, start the conversation casually, just think how our life has changed. I mean, like, everything which is in the video, we couldn't even assume anymore to do. I mean, thinking about people are being excited to be next to each other, raising glasses of some kind of liquids,
Hey,
hugging each other, like and being close together.
now
And look at and look at us now, what we're doing.
yeah.
So how has the COVID-19 situation affected you in the last 6 months, and how are you dealing with it?
Well, the interesting thing about, and I joke when I tell people living in the mountains here, the ski season ended just about the time that the COVID thing hit. So kind of people left, and I live in Park City, Utah. So you didn't almost notice too much. So I mean, in sort of crowds, it's the interesting thing. It's kind of happened in the last month or two. I've noticed it more in the relative crowds because people just didn't come for the summer. So I kind of jokingly say it's easy to social distance when you live in the mountains and have been married for 37 years. So, so for me, the only real impacts has been just all the travel and courses have ended. Okay, so from where
Right.
I live. So, it's obviously the strangest time in history. And I know that's been said 10 trillion times by now. So,
Right.
yeah.
Yeah. So like, I can of course echo you right away. And as most of our viewers know that at the Guide Institute, we've been trying really to steer the educational focus towards online, and that's what we're doing today. And I know that that's what you and I are working together with this new online residency program. So we can just hope that everything will be able to come back to some kind of normal, a new normal, and that online virtual classrooms will give us a lot of information and training options as we've had them in the past, just
Yeah.
without like hugging and kissing, so to speak.
Yeah.
Right.
Exactly.
So give us a little bit a history, because like I think a lot of people, of course, know the name of Ed McLaren. I'll start off with just like a little intro on you. You and I have been working at UCLA together. Me, of course, when I was there as a periodontist and focused really on all the new implant research and all the new implant bone reconstruction. But you came in at UCLA as an already practicing prosthodontist, and then with a heavy focus on education. And you were really so passionate to create an aesthetic dentistry program. And UCLA had it already a little bit, but like, it wasn't really like as developed as you saw it, and the focus that you had. So give us a little bit of that, and then I know that of course you made the next step, and then now you're in Park City. So
Well,
what were the
I think
reasons that you
you and I
moved?
you and I roughly did about the same time. I actually did my pros at UCLA with John Sorensen, and I taught there one day a week. And I think I saw you running around there when you were doing your perio and implants at the same time. And fascinating, John Sorensen, most people don't know this, although because he classically got involved with implants. But Ray Bertolotti used to joke that he was the first prostobondist because he was really heavy into bonding and actually taught sealing dentin. He taught us to seal dentin in the late 80s at the prep appointment. He did it a little differently than Pascal Magnier. So he got me excited about doing veneers and very conservative dentistry early on. And Ray Bertolotti used to joke that I was the second prostobondist. So I got very excited, and I actually started teaching with Bruce Crispin, who started the Center for Aesthetic Dentistry, and it was just a study club kind of thing. And I went along for a while, and the UCLA kind of came to me and said, hey, would you be very interested in coming and taking over, because Bruce Crispin left, and starting something a little more formal, the sort of a residency program, the Center for Aesthetic Dentistry, evolved it into an official program rather than just a weekend CE course. And I said, sign me up. So we started that in 1998. And it evolved from having a couple of dentists into roughly about 22, 24 dentists. A couple of years later, 2001-ish, 2000-ish, I started a master dental ceramics program, because I just knew that if we were going to do something for dentists, we had to involve technicians. So it went along until 2017, and then there was a big change in the power structure schools tend to go. You know, very well, intimately. They just didn't want to go that path anymore. And I saw an opportunity to go to the University of Alabama, Birmingham, and start their program. So I stayed there until just a year ago for 2 years. Unfortunately, they had a gigantic budget cut literally the day I got there. So they cut the funding for my program, and I stayed there for 2 years and had a wonderful time with the people, and taught 20-ish students over 2 years. And it was a great experience for me, but I just couldn't function without funding. And it was just culturally not a good fit. You know, I mean, I'm a California boy and being in Alabama with no money, but stayed for 2 years, and just, I knew there was a point in time that I needed to do something private. And you know, you and I have been friends for a long time, and I've done a few things for you, and I was from afar always admiring, you know, you had more guts, more fortitude than me to start out sooner in the private space. It was something that I always knew I wanted to do. It was something I knew I needed to do, you know, before I got too old and body parts started to fall off, you know, and I, you know, turned 60 a couple of years ago, 62 now. And I figure, hey man, you know, by the time you turn 65 to 70, you start losing the ability to do the things that we do, right? So I decided that I wanted to be in kind of a fun place where I could ski, some outdoors, and an easy place to fly into, Salt Lake City. And so I built a little small space here for 12 dentists / technicians who can come and take a course. So I just started this like March of this year. Of course, the COVID thing hits. And then actually this is turning out to be a blessing in disguise. And we're going to talk about this over the next few minutes, because now I've had an opportunity to reconnect with you. And we're going to tell everybody in the audience here about some things that we're doing in the next few minutes. Also talking about doing some live patient courses with Sascha in maybe in 2021, things like that. So really excited about some of the things that this is created. So
tell me a little bit about the background, because when I look at you and the space that you have now there, obviously it looks very much like a dental laboratory.
Right.
And I'm sure there's a lot of like very expensive equipment which you have sitting around there.
Well, let me screen share for a second, and I'll show you the room next to me, okay? So we're going to screen share. If it comes up here in a second, you are screen sharing. All right, so this is the room next door. So you're sitting, the room you saw behind me just a second ago is the wet lab. So I'm sitting in my wet lab. For those of you who know wet lab, where basically you do all the model work. And actually I have a little science lab next to me where I have some testing equipment. So the room just to my left is a space for 12 people. Actually took out the weight equipment you see in the middle right there. And so that we can do dentist courses, we can do ceramic courses. I shot this in the winter, about just March actually, so that we can do small training courses here if you want to come up here and ski. So, all right, I'll back out so I can see you here. Let's stop screen sharing. So yes, that's the room next door. And then I have a photo studio here. to do photo courses that we'll talk about in a couple of minutes.
So tell me, if we go back to our audience, right? Like,
yeah,
I know that of course
you're sharing here.
You're very specialized, and obviously we're going to talk more about that. But just a question for the dentist. I mean, so many dentists, of course, work with laboratory technicians, and what always like impresses me, because of course I'm not a functioning prosthodontist, although I was trained as a prosthodontist in Germany. And we had a big lab, like really close by to us at the university.
Yeah.
I mean, how much does a dentist need to have a laboratory? Do they need something like you to be a good prosthodontist, or are you just kind of a very unusual character? Or what do they need?
That's a fascinating question and a great question today. You need good collaboration. At a minimum, you need good collaboration with your lab. So they don't have to physically be in your space, but you do need to have collaboration with them in the sense that you need to be able to talk to them. You could be talking to them with Zoom like this. They could be halfway around the planet. With the ability now with the internet, you can hold the case up and talk to them, and that can work. If you have somebody in your office, that does add the extra ability that the patient can meet directly with them. And, more dentists are starting to cycle back to having somebody in the office. Bob Rifkin, very well. Bob just reached out to me the other day. They're looking to bring somebody in their office. So it's not a requirement, but to get the highest end of aesthetics, just like dentists out there, most of you, I'm sure, out there, dentists today, you have a close collaboration with your periodontist. You have a close collaboration with your orthodontist. You need to have a close collaboration with your high-end ceramist. So that would be a minimum, that you're in contact with them. I hear this I hear this daily, if I don't hear it more than once a day, where a dentist that will get a case back from a lab and they'll put it in the mouth and they'll go, oh my God, it just didn't come out the way the last case did. And universally what happens is that in that particular lab, they'll give it to a different ceramist one day and a different ceramist the next day and a different ceramist the day after that. In high-end aesthetics, you need to work consistently with the same person, just like you work consistently with an orthodontist, or consistently with the same periodontist. If I'm doing anterior aesthetics, I'm working with Sascha. I'm not working with Dave or Tim or John one day, then the next day, then the next day. I have to work with somebody that we're all in the same understanding of how to treat a case. And that happens a lot.
I mean, what I remember, this was like, one of the best conversations that we would have is like, Ed, can you just do this? You know what to do. I'll do my part and you do your part. And we just kind of, blindly knew what had to happen. And I didn't have to worry about it, of what your part was and what my part was. That's kind of, you're talking about that, like have this kind of relationship, right, that you basically can trust somebody.
But that's because we've collaborated each other.
Right.
We've calibrated each other, was the word I was looking for.
Right.
So you have to have that level. Yeah.
So let's go into one of our questions, and I'm sure that there is questions from our audience. Is like, there's so many ceramic choices that we have today. And of course, you're not going to be able to pick one, but maybe just give the dentist, from your standpoint, if we're talking about anterior aesthetics, the top 3 things that they should be as a choice looking at.
Okay, so let's start with, the first question that you have to ask when you're treatment planning a case. I mean, how aesthetically driven is the patient? So most patients today, if we're talking about in a high-end aesthetic practice, they're very aesthetically driven. They want teeth to look beautiful, but natural. That when they come out of the office and smile, I mean, they look like real teeth. And patients today, my patients anyway, they want me to save as much healthy tooth structure as possible. The most aesthetic material is still porcelain and minimalistic layered porcelain. So that's going to be my goal, is to remove the least amount of healthy tooth structure possible. And that we all know there's just no argument that we get the best, longest lasting result with bonded porcelain if we bond it to enamel. That solves all of our problems. If we don't have to bond to dentin, and makes it the most simple thing to do. So that's going to be my first choice, is bonded porcelain, okay, to enamel. And now if I can't do that, if I have to bond to dentin, my next choice is going to be a high strength glass ceramic, something like Emax. And there's about 4 or 5 different clones to Emax today. If you like GC's material, you can use GC. Vita now has a couple of choices. Suprinity, Ambria, which is actually a zirconia reinforced lithium disilicate. They found a way to add a little bit of zirconia. Looks very good. In fact, it might even look a little bit better than Emax, okay? I don't think that the average person could see the difference. It's about 15% stronger because of the zirconia. Still maintains a high level of translucency, an excellent ceramic. Now, there hasn't been on the market long enough to know that if that extra 15% in strength makes a clinical difference. It may or it may not. But I can tell you from our experience, and we have documented it very well at UCLA. I've got the numbers. I keep the numbers. One of these days I'll get around to writing it up. If we do full contour monolithic Emax bonded to dentin and well bonded, where we've sealed the dentin, the success rate at 10 years is virtually 100%. So wow. Excellent clinical technique, sealing the dentin a la Pascal Magnet's technique, monolithic, meaning not layering any porcelain on it, it's virtually 100%, okay? Obviously.
And sealing, you're talking also about using rubber dam, or you're?
Well, rubber dam is sort of an interesting thing. I'm a believer in clean and dry. Okay, so if you're able to isolate, with something like an ISO light system or ISO dry system, and use cord, it's not 100% required that you use a rubber dam. There are other ways to keep a dry field and to keep it clean. There was a guy named Greg Gilbert, who's a very good researcher at the University of Alabama, Birmingham. And he did a practice-based study and he got a $60 million grant for this. He went into practices around the United States, and one of the things he looked at was, did they use a rubber dam or didn't they use a rubber dam for success in anterior bonded restorations? And he didn't find a particularly big difference for success or failure of anterior bonded restorations, as long as they used cord and got the field that was dry. Now, this is a hard thing to exactly differentiate, right? Okay, but as long as there was maintained a dry field, they used cord, isolite, iso-dry, something like that to maintain a dry field, to maintain a clean field. Okay, yes, of course, the best way to do it is with a rubber dam, tie the rubber dam off. But if a dentist refuses to do that, and some do, okay, if they use something like an Optrogate cord, an isolite system, you can still get pretty close with that, okay?
Okay. I'm always afraid to tell people okay, you know what, you don't need to use it because the results are the same. Because I always believe in give them the highest standard that needs to be achieved.
Yeah.
Because I know that my friends, the dentist, and I have a lot of them like you do, they like to make their, their own compromises then. So when I give them already a compromise, let's say in whatever, then they go lower than that. So, but it's interesting that you say that there's been such a large study, as long as they can keep it dry, then that seems to be sufficient. So that's a good thing to know.
Well, with isolite or iso-dry, it seems to get the same results, but I would strongly recommend to use the rubber dam. Yes, I would strongly recommend it. But what we don't want, you walk into some practices or some places where you look and you see somebody cementing something with nothing. Okay, the probability of failure of doing something like that's going to go up for sure.
Perfect. Okay, so like what I took away from this topic from ceramic choices, like something like Emax seems to be really like very high on your list.
Sorry to cut you off, but let me get to the most important topic now, I think, of the day is zirconia. Okay, and it's the most misunderstood material today.
It's good because it was my next question was about zirconia. So it's perfect.
Okay. So clearly for bonded restorations, if you want to be in the safety zone where you have super high success rate, okay, you want to be highly aesthetic, and it's mostly an aesthetic case, not a function case, mostly enamel. You use porcelain. You'll be 100% safe. Of course, you could use Emax there. You could, no problem, because it's a very strong material. But porcelain's very safe there. All right, now if we're in a situation where you can't bond very well, okay, you have subgingival margins, maybe you're prepared for a crown, maybe there's high potential for flexure. Whenever there's high potential for flexure, maybe a tooth has been over prepared, maybe there's leaky margins, maybe there's a lot of composite. The more something flexes, the less it supports. So understand the nature of mechanics, okay? The more something flexes, okay, so the tooth flexes, the less it supports what's ever on top. All right, so everybody can probably get this visual. Okay, in your backyard, okay? So everybody knows what backyard looks like. It looks like grass. You got grass in your backyard. Okay, if you put a really thin piece of ceramic tile in your backyard on the grass, okay, 2 millimeter thick grass tile, and you ran a lawnmower over it on top of your tile, what's probably going to happen to the tile? Or your kids jumped on top of the tile, it's going to break, right? Because the flexibility of the grass is going to bend and the tile is going to break. All right, now if you put that same tile on top of steel reinforced concrete and you bonded it to the steel reinforced concrete, okay, you can jump on it, you can drive a motorcycle on it, you can drive a car on it. The tile won't break, okay, because by definition now, it's what's called a constant strain system, meaning it's glued together, it's a fused system. So whenever you have a fused system, the material that has the highest modulus of elasticity, the stiffest material, absorbs the stress. Okay, that's what bonding does to two different materials. It's not just holding it on, it does hold it on, but whenever you bond two dissimilar materials in elastic modulus, the stiffer material absorbs the stress. That's why porcelain veneers don't break on enamel. That's why porcelain doesn't break on metal. That's why porcelain doesn't break on zirconia. When the dynamic changes to dentin because of its flexibility, porcelain breaks. When it changes to dentin, even with glass ceramics, you're going to see a little more breakage. Because glass ceramics, it's strong, but it's only 400 megapascals. Zirconia starts at 700 and goes up. So the reason why you want to use zirconia when you got a lot of dentin, okay, or can't bond, really when you can't bond, because we can't get that force transfer, we can't get that lamination effect. So the time to use zirconia is when you can't bond. Okay, so that's the fundamental time to go to PFM. Nobody uses PFM anymore, but the fundamental time to go to zirconia is when you can't bond. Okay, because we're not getting that force transfer effect from adhesion. And that's, very few people understand that or talk about that. In fact, probably your audience goes, oh, I've never heard that before. That's what lamination does for you, other than adhesion. In fact, it's the #1 effect, really. Okay, so that's when we're going to go to zirconia when you can't bond. Subgingival margins, maybe you just don't even want to bond. It's a crown, okay? You want to just use cement. All right, now let's get to the topic of zirconia. So we all knew about something like lava a million years ago, and you heard lava-like products. And the product lava was called a 3Y material. What are all these Y's? 3 Y's, 5 Y's, what did all that mean? Okay, a 3Y material was a material that had 3% of the molecules yttria, which meant 97% of the molecules were zirconia. So 3% of the molecules, they put yttria in to stabilize the zirconia at room temperature in a tetragonal form. Otherwise, it didn't. It was something else at room temperature. Ceramic engineers increased the amount of yttria to 5% of the molecules, yttria, to stabilize the zirconia at 50% cubic phase at room temperature. So when you increase from 3% to 5% yttria, it stabilizes 50% cubic phase and 50% tetragonal phase. 100% cubic zirconia is a fake diamond. We all have heard that fake diamond, the cubic zirconia. So 100% cubic zirconia is a fake diamond. So when you hear the term 5Y, we've been throwing that around, 5Y, 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 and 3Y was the original. 5Y is half fake diamond and half the original tetragonal zirconia, the original opaque stuff. All right, so what is that stuff? That stuff now is the stuff we've been using for the translucent zirconia. There was a kind of a trade-off though. It dropped down from 12, 13, 1400 megapascals, stuff you could drive a truck over. And in fact, Glidewell had an ad, they drove a truck over it. Old ad, actually. The strength dropped down to 750, 800 megapascals. Still strong enough, supposedly, according to the ADA, that you could make a bridge out of it. Okay, because the ADA guidelines is 800 megapascals to do a bridge. All right, now here's the interesting thing. The original material, the 3Y material, the lava material and all the lava clones from 15 years ago, had this unique property in zirconia. And we all kind of knew this, that you could sandblast it, you could grind on it. They called it white steel. You could do anything to it and you could not crack the zirconia. Porcelain chipping, different story. So you could grind on the zirconia, it didn't do anything to it. And they call it transformation toughening. It got stronger actually, because there was unique crack healing property. Now, I'm written a couple of papers on this and trying to get this more information out on this. And I have a whole lecture on explaining this with graphics and stuff coming up in this series we're going to talk about in a second. The assumption that the 5Y material, the half cubic, half tetragonal material, has the same property. You can grind on it, sandblast it, do whatever you want, and you don't lose any strength. It doesn't lose strength from 750 to 500 or less. Glasses or Emacs, you can't sandblast. If you sandblast a glass starts out at about 120 megapascals. If you sandblast a glass, it's 60 or less. Emacs starts out at 400. If you sandblast Emacs, it's 200. You lose 50% minimum strength sandblasting anything that has glass in it. Okay. We tested this, we published this 3 years ago, and companies seem to be hiding these numbers. I was afraid my car was going to blow up. I've had so many threats. If you sandblast If you sandblast a 5Y material, it drops to about 450 megapascals. So you lose about 40% of the strength. Now here's the good news. 450 megapascals is strong enough for a crown. It is strong enough for a crown even with conventional cement. So here's going to be the moral about a 5Y material. Use your 5Y materials only for single crowns. Perfect. Like I said, that's fine for single crown. So I'm using the 5Y materials. Okay, that's STML from Noritake, UTML from Noritake, the lava, and everybody else. There's about 1 million clones out there. Probably 30 clones out there, 40 clones, 50 clones. So use that for your singles. Okay, now what are we going to do for bridges? There are several companies now that just rush to the market, and I actually did testing for 2 or 3, and I don't charge for my testing. I probably should. My wife consistently says I'm going to be the most famous poor man in history. I've never taken a dime for my research. I never have, okay? Never taken a dime for a product. They pay me for the lecture. If I go to a lecture, I do get paid for the lecture, but only for the lecture. So companies now rush to the market. The first one was from Ivoclar called Zircad MT, okay? They thought, okay, well, if we add yttria, it increases the translucency by adding the cubic phase. 5Y or 5 mole yttria maybe increased it too much, so we lost that ability to sandblast. What if we just put in 4Y, 4% yttria, okay? So instead of 5Y, 3Ys only tetragonal. 5Y gives 50% cubic. What about 4Y? What happens if we put in 4% yttria? So if you put in 4% yttria, what happens is you get only 25% cubic phase and 75% tetragonal phase. So interestingly, Zircad MT, okay, that's from Ivoclar. Vita just came out with a product. I tested it for them. Can't remember the name off the top of my head. Just remember 4Y, 4Y, 4Y. Argan has a product, Argan Z, okay, HT. At least 4 companies. White Peaks has a product. I tested it. It is almost as translucent. 90% as translucent as the 5Y materials. Here's the good news. Oh, Vericor from Whipmix. Tested it too. They're 90% as translucent as the 5Y materials. They look almost as good. They're all right at 1,000 megapascals. They do not weaken by sandblasting, so they still maintain their strength. So here's the moral to this story. They are the materials for bridges. They are the materials for all on 4. My recommendation to you, and I think Dr. Jovanovic would agree with this, I'd add an extra implant or 2. I don't like the idea of all on 4 because it's been coined none on 3 when you lose one. I'd add a couple of extra implants. So let's just summarize that whole topic. So for single teeth, I would use a 5Y material. For all of my bridge work, I would use a 4Y material, okay? You cannot bond those materials, by the way. No matter what they say, no matter what you're hearing, they do not bond well, okay? You can get a little bit of chemical attachment, you can get a little bit of roughness, but we cannot effectively etch them very well. There is a product coming out of Korea that does increase it, but it's not nearly as good as a etched glass-based material.
Now, Ed, you have like your brain is just like is like a dental ceramic encyclopedia, and obviously us normal people who are working with prosthetics and ceramics on a daily basis as well, but we don't have the encyclopedic mind. do you have something that you can share with us, like that is simple, like a PDF where you have this written down, like what companies we should be looking at, what laboratories, what we can tell laboratories, because the laboratory is just going to tell me, well, what would you like us to use? And they have a range of things that they're going to give me at a different price.
Yeah,
So how would you like me to remember all this?
Yeah, Paul, you're watching. Do me a favor. Put in a couple of questions to an email, and I'll pull out a couple of names and specific products I'm recommending for 2 or 3 companies, and set that off. Okay.
Yes, will do.
Okay, perfect.
Thank
you. Now I think this also will give us a great moment to now talk about our short moment about photography, because like I know that photography and aesthetic dentistry is huge. I mean, we're just like dead in the water without that. So number one, do you recommend each dentist who is working on aesthetics to have 1 camera, 2 cameras, no studio, yes studio, to get a software program like DSD or another one, and maybe just give some short recommendations there?
Okay, great. Why don't you, best thing, I mean, we got the opportunity to be visual here, okay? So let me share screen for a second. I'll bring up a presentation and go through about just 4 or 5 quick slides, okay?
Okay. And then after that, we're going to get into like our new online program.
Yeah, but I think since that is a very specific question, so I'm going to bring up a presentation I put together of photography for dental professionals. Let's open that up. So one of the things, that's a great question. There are, about 10 years ago was the last photography course that I taught. And I kind of got out of it because everybody and their brother is teaching a photography course. And several people reached out to me recently, well, actually before March, and said, hey, Ed, would you mind teaching a course again? And I said, sure, I love doing that. And they said, what I'd really like you to teach is how can we get high quality photography with simple equipment? And also I need you to really teach me how to use the camera, because everybody's been teaching people how to be a professional photographer, which is great, and work in a studio and things like that, but not really how to set the camera, how to really control and get a good image. And so let me just pull up a couple of things here. So one of the things that it's going to be, and I'm going to do this in the presentation. So what Sascha just mentioned is, I just put together, this is a great thing that's coming from this bad event, this COVID event. I've been working the last 2 months on putting together an online residency for Sascha and me, for Guide, of 25 sessions. And a couple of the sessions are going to be on photography. And so basically, how to use a digital SLR just with simple little things, and some of the things you've seen, but really how to do simple camera settings and the correct camera settings with some very inexpensive equipment. You've all seen these pocket flash, whatever name is escaping me right now, excuse me for a second, from brain dead for just a second, and reflectors right here.
The company in Los Angeles?
Yeah.
Photomed?
Yeah, you can get these from Photomed, but reflectors here, but just how to set this to just get this image just in one shot. And that's really the important part, that I just took one shot to get this image. There's no Photoshop here. Just a very clean, simple image, how the camera can be set up, okay? And then this will be part of what I'll show you, okay? Then I found with one of my students some really inexpensive things called flash discs to hook onto on-camera flashes. You can either hold them, it's called a flash disc. simple on-camera flash. I use Yogno. They could be Godox. They could be Nikon. They could be Canon, okay? But the aftermarket flashes are a lot less expensive. And that how we can take just a super simple picture, even in an operatory. This could be an operatory space and be able to get this kind of picture. There's no Photoshop. So I do have a third light behind her so we can get a little bit of glow. All she's got on is lipstick. We didn't put anything else on but lipstick. It's my assistant, Christy, okay? Oh, okay. And so we'll go through what the equipment is. This flash was $35. The stand is $20. It's called a flash disc from F-Stoppers, okay? And then I'll show you how to do it to take some intraoral images too. This was done with intraoral image. Obviously we can use the on-camera flashes, but we can get some really nice detail with very small, inexpensive stuff. And what I like about this is this flash disc folds up into this little small circular thing. Okay. Nice. And then Diego is going to, one of my former students, Diego Michel, is going to teach you how to take this, and where was this here? He's going to teach you how to do, in this course, some benchtop photography with the same little things. Okay? We're going to take those same flashes and with really inexpensive soft boxes that attach on the end and some cheap little pieces of plastic. I'll show you where to get these on the internet. You know, you can put these in a drawer. So if you're in a hurry, you want to take a picture of a model, maybe your lab did a waxa, maybe they did a cool crown for you, and you want to take a cool picture of a lecture, or maybe you got an extracted tooth you want to take a cool picture of, and we just put that on that little piece of plastic, okay, and took this picture. Well, you know, maybe you don't lecture, but maybe you want to show something to your patient. You want to show something like this. All of those pictures were taken on that little black piece of plastic or the little white piece of plastic. With very inexpensive equipment, it's about $300 total of equipment, okay? The white background, we just put the tooth on this, on the little small soft box and shot it this way. A little
so
bit
now,
yeah.
Ed, like probably an additional question. We also have like a lot of young dentists who obviously work as associates, and they work, you know, like even maybe in different offices where maybe the offices are not that sophisticated yet.
Yeah.
These seem to be pretty mobile, these things that you have. Obviously a camera is mobile.
Yeah.
These small discs are mobile. Is that something like, you know, somebody who's an associate, it seems inexpensive, can all develop and put like in a little bag and then carry it from office to office?
That was the exact thought process, Sasha. This is, you can get this down to 18 inches. You can get it 24, 36. This folds up into a small little ball too, okay? This is this folded into a small ball. This goes down into a teeny tiny little thing. In fact, that's a good idea. Paul, I know you're listening. Do me a favor, send me a message to fold all this stuff into the bag that I have and take the picture of the bag. Okay. And I'll put that into a thing. Now, here was the last thing I want to show that's cool. Okay. All right. I'm also going to show, I have two little videos of how I use either the Smile Light MDP. This is from Smile Light. Now, this is not an inexpensive toy. It's about $700, but if you want something that's real small and quick and probably the easiest thing to use on the market, I would have either this one or I'd have the one from Photomed. Okay. Photomed, they call it SDL, Smile Dental, something Dentalite. I'd have to look up what it means. They take a pretty reasonable picture. You can't make a mistake with this. It doesn't take a great picture, okay, but it takes a decent picture. So this is the one from Smile Light. It's called Mobile Dental Light. This is something Dentalite. Can't remember what
Mm-hmm.
the S stands for off the top of my head right now, but they take a pretty reasonable picture.
Good,
So,
good, good, good.
yeah.
Yeah, that's great.
Okay.
So,
And
okay, so now, you know, of course, like, you know, we have so many dentists, young dentists who are graduating. We have already established dentists who want to focus on new areas. And of course, the new areas are aesthetic dentistry, or implant dentistry, or maybe even some dentists are getting into like periodontal microsurgery. So, what do you see that you have now available? And of course, I'm steering you in the right direction. How can the dentist, under the current conditions of COVID and also the new normal in the future, what can they learn from you online, and what are you putting out in the very close future? We're talking about September as an online residency program.
well, perfect. Let me close this down. And I did throw a few slides together. Where is it? Okay, so that was the interesting thing about this. I know that I think we all heard this, that as this started to happen, the COVID thing, I mean, there was this strong recommendation from, let's say, the psychological world to say, do something productive, do something exciting. And when you reached out to me to do you know, how this started, Sascha reached out to me and said, hey, would you be interested in doing one program? And I said, no. And he was surprised. And I said, I'll tell you what, I'd be interested in doing a whole residency. And he said, go for it. So I thought about this and I thought, hey, it'd be wonderful before I die to put my brain on the internet and to do a whole comprehensive program. And so what I thought might be 10 programs, actually it's turning into 25 sessions and 7 sections. And so I've really moved from being I was taught as a classical prosthodontist, but I really believe in minimalistic dentistry today, and being as conservative as I possibly can. So this is going to be 7 sections. I'll try and go through this quick, over about 5 minutes here. The first section is going to be of the 7 sessions. We'll get into artistic principles and what I really believe aesthetic dentistry is and should be. I'll talk about how I analyze the patient. We'll go through the photography. We talked about how I teach photography in that simplistic fashion, and those would be a lot of very detailed imagery and some step-by-step through video work. And then I'm going to teach you Photoshop from the beginning. If you haven't learned it, you will learn it. And those of you that know it, I have some nice little tricks. And then I'll teach Photoshop smile design. And one of your questions, Sascha, I actually believe everybody should have a program, something like Christian's Coachman's program. But I also believe you should know how to use Photoshop, or there are several other programs out there on how to edit an image, because it's not just sliding a slider left and right to show a before and an after, because you need to engage your patient. So after, you could do it before and after, but then you're sitting with your patient, the patient says, well, what about if you do the tooth this way? Or what if you do the tooth that way? So you're sitting there very interactive. Okay, well, let me show you if the tooth is a little rounder. Let me show you if this tooth has a little bit of this, a little bit of that. And you're engaged with them. And when they see that you really know what you're doing, you're more likely to get them to buy that case. Okay, so that's why you need to know how to play with this a little bit. Okay, so I did something to the screen there. I'm not sure what I did. Then part 2 is bonded functional aesthetic prototype. Really, how do you get them into something functional? It's a fancy way of saying an upgrade to the mock-up. And then how do I design the case? I mean, how do I get into function? Okay. All right, part 3 then is what we talked a lot about just in our interview there, contemporary dental ceramics. And then how do you choose a material? So I'll go through that in a lecture. And then how do I treatment plan? How do I decide, is it a crown? How do I decide to prep? How do I decide to take off tooth structure? Is it an inlay? Is it an onlay? Is it a vonlay? A concept of partial veneer, partial crown, partial this, okay? And then the near and dear part to all of us. We want to treat some teeth, right? Okay, so I'll spend a lot of time on prepping teeth, okay, and not prepping teeth, okay. When can we get away with almost no prepping teeth? And we'll go all A to Z, and anterior and posterior, and that'll be about 3 sessions. It's 25 sessions, but it's about 60 hours of material. And the great thing online, you can skip to something. Maybe if you feel you've got everything down on how to design a case, you can just go right to prepping if you want to. Okay, so then how to do a blockout restoration, which is very different than a buildup. And I give concepts on why we don't need to do a classic buildup, but we want to maybe block something out. Sealing dentin, and I strongly believe in sealing dentin. I've been sealing dentin since 1988. John Sorensen taught us to seal dentin and do what's called a blockout. So we'll talk about that, different techniques for that. Then we're going to get into direct restorations. I'm not the best on direct restorations, so I reached out to one of the best, if not the best in the world, Didier Dici. So he's going to be teaching anterior and posterior direct restorations. Many of you know that name specifically in Europe, probably the best educator anyway, if not the best at doing it in the world. Then we'll get into shade analysis and communication. I'm really known for that technique. We'll talk about how to use computers, and we're going to integrate Dr. Johan Figueira in those techniques, and also the digital integration in aesthetics. And then the last part to finish up, current concepts in adhesion, talking about universal adhesives, cements, and then a topic near and dear to me, the final touch on how we finish restorations. We all know that everything's moving toward a monolithic environment, whether it's veneers that we might machine and or composites that we might machine, or even direct composites. But how do we put that little artistic touch to what we do, both in color, form, and surface texture? And I'd like to thank my other conspirators or co-teachers. That's Dr. Dici, Dici on the left, Dr. Francisco Matroni, who's one of the top prosthodontists in the world from Italy, Dr. Jovanovic, he teaches with quite a bit, and does some courses with him, Dr. Johan Figueira, many of you know out there, and a new young superstar who's trained with me at the University of Alabama, who's a prosthodontist and a professor in Mexico, and back in Mexico now, who is just one of the most gifted. I mean, this kid's kid, God, when you say 33-year-olds are kids, that kind of dates you a little bit, who is going to be teaching on the benchtop photography. But watch out for him. He's going to be one of the true leaders in education in the near future. So I'm really excited to have all those people on the team. Many of you know I spent 22 years at UCLA, 2 years at the University of Alabama. So that will be the topics there. So
that's I mean, like, you know, I think the most important thing, Ed, is just like what you said, is like you're of very few experts out there. I have to say, there's some, but like very few. You are willing to put out your brain, as you said it, or your experience and your knowledge and your kind of educational ability on the internet. And so that's fantastic, because if you really think about dentists today, they're getting more comfortable in learning online, and they need this, because how else are they going to be able to learn how to be a better dentist in their office and to do good dentistry? Because, like, you know, we got to get away from, like, especially young dentists who are just going to an office, and now all these offices just want these associates to do like production, and they don't really know how to do it, because the big boss wants to do everything themselves, because that's the big probably like financial reward. And then we have the dentists who really want to learn. They actually don't get taught. But now we have an opportunity with this online course for them to really get like something which otherwise they only could get at the university. I mean, so I really compliment you on wanting to do this. I compliment you on of course, as a friend, on doing such a great job over many years, and also doing that together with Guide. So it's a great job.
Yeah. Well, and you know, it's been, you know, this is just one of those unique rarities that just had the time, because everything just sort of stopped. It would have never happened, honestly, if it wasn't for you, because I don't have the avenue to get this out, and the timing, and it was something I kind of wanted to do. And we're going to keep the pricing super low. I mean, I think it's worth trillions of dollars, of course, but the pricing is going to be amazingly fair. Each one of the programs should sell for a couple $300. Basically, that's what we're going to sell the whole program for. You know, obviously there is some expenses because we have to record everything and things like that, but and please share it with everybody, you know, recommend it to everybody. Obviously there was an immense amount of time. I've been working on this for 2 months, and then, you know, Sascha has to pay all of his people to record all this and get it in internet format. So we're looking to go live with this, I believe September 15th. And
Right,
so, yeah,
right.
I'm excited.
Paul, can you let me share the screen for a second? So, okay. No, that's the wrong one. No, can you take it off, Paul?
You're having
forget about it.
trouble? You should have the
Yeah.
ability to put it on there.
Okay, there we go. Photos. No, it's not working for me. I'm so sorry, ladies and gentlemen. What I wanted to do, I just wanted to give you also a piece of information, which I think is great, is if you have not yet, or if you're not following Ed at this moment, I mean, he's very active on social media. There's a lot of good clinical work and great examples of what we're discussing on his Instagram feed. And so I would like definitely recommend you to look at that as well. And of course, on Guide, the Instagram feed, we have also a tremendous amount of work with Ed, like especially coming up for this online residency program, and a lot of other work which we do with other experts. So thanks for putting up all these emails. So keep doing that, and you can always like contact Ed or myself, or of course the Guide Institute. And for everybody who has been part of today, I want to thank you for coming on and being interested in this here. I can only tell you that, look, this is how we learn. I mean, if you look at the hard work that Ed is doing and the hard work that I've been doing, nothing is possible in your practice to be successful without putting this kind of focus and passion into it. It's like the discipline, you know, of course, like you're going to fail or like you're going to make mistakes, but, you know, you're going to learn from that. So the more you train yourself, the more you learn, the more you listen to experts and show your interest, the better you're going to get. And the rewards are going to be there, because as you can see, like it's fun to see Ed, who disclosed to his, you know, that he's 60 plus, but like, I'm sure that like at 24 years old, he was as passionate about dentistry as he is today. And that's kind of one of the things that you will learn by being more in tune with what dentistry is, and knowing why you're doing something, and not just like how to do it, but really why you're doing something. And like, you know, just those few examples that Ed, you were giving about Zirconia dentistry and the materials and the contents and the percentages, that's what like makes the person stay in position of really control, very loose about it, not like, you know, tense and trying to grab everything they can get, and really looking just at financial rewards, No, you're going to look first at being satisfied with what you do, and then obviously, like, you know, everything else will follow. So I'm going to close the session. And Ed, I wish you a great rest of the day. I know you always are busy till early morning, and I look forward to our very next conversation together.
Great. Looking forward to see everybody out there. And one thing to add, along with the sessions, we're going to have 2 live interactive sessions on treatment planning and stuff like that. So hope to see you guys out there in this format.
Right. And Ed, I know that from 2 could become more.
Yeah. Awesome. Okay.
Okay. Everybody stay healthy, stay safe. I know we're still not out of the woods, and it will probably not be for a long time, but I can promise you that, like, you know, on our internet, at least we're safe and distant, and we're still communicating. So Ed, to you, first of all, stay safe in Park City. I know you do. And to everybody else who is logged on from different parts of the world, thank you, and stay safe. Bye, everybody.
All right. Bye, everybody.